At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Brain Fog and Memory Loss on Wednesday, February 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. This is Dr. Tom Roselle, and it's a frigid Sunday in the nation's capital. But you know what? It's going to warm up this week. This is crazy weather, right? You know, I think I was still living in Jamestown, New York. And when I looked outside the other day and I saw the snow, but not quite as bad. I guess Buffalo cumulatively this last week got close to 70 inches. Or that's what the rumor has it anyway. But anyway, it's a beautiful day. So bundle up, put a hat on, put gloves on, scarf around your neck, and go for a long walk. You'll really enjoy it. But make sure you take me with you if you're going to do it right now. It's important that we start moving forward in a new way coming up in 2024. And that new way is simply this. We are going to be doing live stream immediately after the live broadcast on WMAL. It'll be at the 12:30 mark, and just simply go into drtomroselle.com. And there'll be a screen sitting there that says hit here for live stream. It'll be right in front of you. You won't be able to miss it. And it'll take you right to the live stream. And those of you who are on social media, whether it's Facebook or Instagram or Twitter or tons of them, follow me, and you will be noticed when the live stream is there. So you don't even have to go to the computer. All you got to do is hit your cell phone, and you'll be noticed. And we'll get together, and we're going to give you all kinds of data. We've made a decision to make sure that we reach you in every platform that we possibly can, to give you as much information as you need to have your healthcare freedom supported by information and knowledge. And that's why we are doing this program and continue to do the program. Want to remind you, relative to education, February the 14th at the Roselle Center for Healing in Fairfax, we're going to be talking about memory loss and brain fog, or brain fog and memory loss. And we would love to have you there. I'm going to be co-presenting with Dr. Qinglong Zhang, and we're going to give you a ton of data and tell you what really happens. It was part of the program today. And by the way, when we go into live stream today, there's going to be a very dear friend, Dr. Richard Belly from Sacramento, California. Well, he's a genius, and he's an amazing expert on the subject we're going to be talking about. Anyway, join us, when we're through with this program, and go directly into it. But let's get into the program, and let's talk a little bit about brain fog, but I want to do it from a place of trauma. I watched football last night, and have a history of playing ball and martial arts and so forth. But what happens when you get your bell rung? And by the way, it doesn't have to be a heavy duty hit like that. It can be simply you got a little fender bender about 10 miles an hour, and your head recoiled against the seat and back and forth, and your brain bounced off the inside of your skull. That's called trauma. How many of you played sports of any kind, basketball or volleyball, but more importantly, how about soccer? How about lacrosse? How about things of that nature? How many took a fall? How many of you sat on the sofa watching a television program and you fell asleep and your head went down to your chest, and not only did you get whiplash and your neck and shoulders hurt, but also your brain got beat up that way? What I'm trying to tell you is that these little incidences of what seems to be nothing sometimes can add up to a whole lot of everything. And it's important that you understand that. It's important that you understand that traumatic head injuries, or what we call, traumatic brain injury, can cause all kinds of problems, but particularly short-term memory impairment. But if it's not treated properly, if you don't realize that there's injury, that the nervous system has been hurt in some way, you can't get back to normal. And what happens is the development of more progressive dementia over a period of years takes place. So we have to make sure that we take the steps, if you will, to protect ourselves from that ongoing pathway. That can be done in a lot of different ways. We can do it with certain types of nutrition, but more importantly, if the brain, the skull has been injured in any specific matter platform, you have to make sure that the cranial plates, 22 of them that you have, are able to reposition themselves so the spinal fluid isn't built up like a heavy load within the brain, squeezing your brain, if you will. But memory can be categorized into two different functions in trauma. And trauma has a way of affecting function throughout the entire body. Now, why? Memory is related to several different areas of your brain that serve purposes. Trauma can affect your memory in significant ways that impact trauma recovery. So what does that mean? That's kind of a weird statement, right? Well, what it means is that if your body neurologically can't do what it's normally meant to do, if it can't connect the dots, then you're not going to recover and repair. There's actually 4 different kinds of memory that the neurological system and parts of the brain have. And when there's trauma, there's a combination of impact, injury, inflammation, swelling, and so forth that can cause these things not to work. There's something called semantic memory and trauma. This is a kind of memory that has to do with remembering general knowledge, such as, knowing who, the president is, or knowing, as maybe we want to forget who the president is. I don't know, I'm just saying, knowing, and what an orange is or an apple is, or knowing the difference between a car and a truck. Semantic memory is associated with the size of your head, the temporal lobe area, and the lower portion of the lateral part of the brain called the parietal cortex. And that information, if you will, from different parts of the brain can confuse things such as words and sounds and images and so forth. So semantics, if you will. And the area of memory that is damaged is particularly problematic for children. And because when they fall down, they get their head ringed and so forth, so to speak, it can cause the brain to be rewired in a bad way. And we've always pointed out that memory and the brain is plastic. It can repair itself. It can rebuild itself in a good way, but it also, if it's not taken care of properly, it can repair itself in a bad way. And so there's ways of dampening that down. There's ways of making things easier for the brain to recover. And we're going to really get into that. We're going to make a difference. Now, there's episodic memory. Episodic memory has to do with how you remember specific events, including, traumatic memories, things that are upsetting to you. It can be a blow of trauma, like an assault. It could be a physical or emotional pain that you've experienced over time, and you hold on to that. Your body neurologically remembers everything that has taken place over a period of time. So when you understand that that's the case, we have to make sure that we identify where it is and what's happening. That area, by the way, that we're talking about episodic memory and pain, is called the hippocampus of the area. And the hippocampus has to do with so many different reactions. You've heard me talk about something called HPA axis. And what that means is hypothalamus, pituitary adrenal. It's not the hippocampus, but that little guy has a lot of effect with those other pieces of the puzzle. These episodic memories can become confused, and trauma survivors, things that have happened to us, and even begin to doubt themselves when their memory doesn't line up with certain facts as the timeline that had occurred over a period of time. It's a confusion piece. So I know this sounds, like, oh my gosh, right? At the end of the day, you have to be able to put the pieces together to be able to help somebody. And that's what we do on a day-to-day basis. Patient comes in and they're telling me, well, I have this problem, I have that problem, and so forth. And I start asking them questions subtly about memory patterns. I may go back and ask the same question 2 or 3 times. It's a subtle way of kind of gleaning information. There's procedural memory issues as well. And that has to do with retaining memory and how to do certain things. Riding a bike, driving a car, remembering the code for your security system, your passwords on the computers and so forth. I guess so many of them I forget anyway, just because I'm confused about how many that I put in place. But trauma can cause you to unconsciously tense muscles, and because you're going into what's called a fight, flight, survival mode. And if you're locked in that fight, flight, survival mode, then that tension becomes a habit because you're always feeling on edge after trauma. And so you're stuck in what we call sympathetic overdrive. So you do 2 things. The nervous system does 2 things. It allows you to fight the tiger, that's sympathetic fight, flight, or it allows you rest and repair, and that's called parasympathetic. But if your memory continues to be recidivistic, continue to produce this fight, flight phenomena because it was so traumatic, was so emotional, was so upsetting, then guess what happens? You never get out of it. The emotional memory has to do with emotional responses you get from different types of triggers. Like feeling scared or anxious when you drive past a location where something had happened. Years ago, my wife and I were in a head-on accident in Herndon, and it was up near Herndon Parkway and Eldon Street. And we were at that light. And what happened is a big Dodge Ram hyper-accelerated the block, came over the divider. I was doing about 12, 13 miles an hour, getting ready to stop for the light. And this big Dodge Ram collided head-on to us. It's something that I don't want to ever have to think about again, but I can consciously remember it. But I had to do some work to make sure that the triggering mechanisms weren't still there over a period of many years. That's the type of emotional memory, or something happens to anybody physically, an abusive situation and so forth. Those are all emotional triggers that can cause damage. And subsequently, what happens is that recidivistic situation continues to show up, and those emotional memories can last a lifetime and can significantly affect your well-being and mental health. But more importantly, what it also does, it confuses the neurological circuits, so it starts producing neurological dysfunction. And this is, a kind of a loop-de-loop situation. And on February 14th, we're really going to get into it. And join us. All you have to do is go to drtomroselle.com. You can register from there, or you can go to rosellecare.com and register from that site. And we'd love to have you there. We're going to get into this in depth. And then you have another piece. It's called Integrating Traumatic Memories in Trauma Recovery. So all these things that we're talking about, it's important that we're able to reestablish a footprint, if you will. Trauma survivors may feel like they're going crazy because of all the different responses they get in the brain, the confusions, the losses of patterns. Now, what I want you to understand is that it's not permanent necessarily, unless there's neurological damage. The brain is plastic. You'd have to destroy a whole lot of the brain before you can't re-imprint memory patterns and directives and understandings and so forth. It takes time, some of the patterns out there, but you have to get rid of the inability of the brain to communicate and be able to relink itself to other pieces. So when it comes to memory, remember to think about, let's say the filing cabinet and how much disarray has happened, in that filing cabinet. It's no longer, you can't audit it anymore. The tabs on the files aren't there anymore. I talk about filing cabinets because I'm old school, but let's talk about just the computers. How many of you have open files all over the place? You put things in there, you want to remember where they're at, but now you're confused because those files are scattered. You have a screen that, your desktop that has tons of things that are discoordinated, and that's what happens to the brain. Trauma recovery can be difficult. because now you got to sort through all of these files, emotions. You have to talk about the difficult things, the experiences. You have to work through the trauma, and that's just that piece of it. Now, the next step is you have to re-coordinate all the neurological synapses from one piece to the other, to the other, to the other. But how many of us over a period of years seem to get more and more disconnected? We're not present. We don't realize what's taking place around us. That can be due to not only emotional trauma, but you can have physical trauma that will cause the emotional expression of something of that nature. So you have a multidimensional approach that you have to look at. You have to look at the triggering mechanism. Was it an emotional trauma? Was it a physical repetitive triggering mechanism? We roughhouse and we do this, but here's the other catch along with it. What happens if you have a physical and emotional trauma tied together all at the same time? Now you really have a bugaboo, right? So the body is going to go into protective. You're going to try to suppress the memory, but you're now going to have a constant recidivistic pain pattern that is always present, and you don't know why, no matter what you do about it. So you have to link both. You really have to release the neurological platform. We call that injury recall, by the way. And the injury recall is nothing more than bringing it up on the screen so now it can be dealt with. It doesn't fix anything by itself necessarily, but it now allows you to find it in a very specific way. Now, I'll give you an example. Let's say that somebody was abused, okay? And I mean physically smacked around, that sort of thing. So you have this height of screaming and emotionality and so forth, but now you've got neck and shoulder problems that just never go away. So this person's always going to somebody to try to figure out why they have neck and shoulder problems. And it's a real neck and shoulder problem because the body remembers the neurological injury tied into the emotional platform. If you can't fix that, then by fixing it, I mean that you have to bring up that old injury recall piece, that neurological representation of what was there, and then fix the trauma that caused, meaning the residual injury that caused that neck and shoulder problem. It's never going to go away. And you keep dumbing it down, you keep avoiding it. Nobody can fix me. It's not there. The body's designed to fix things, but you have to bring up the right representation on the computer screen so you can see what needs to be done and then refile it appropriately so now you can begin to reorganize everything else. I know it sounds a little confusing, but emotional trauma tied into physical trauma, blows and traumas, falls and spills, things of that nature can be quite significant, and they just never want to leave you because one is only being addressed, the other one is not. So you have to learn how to move past the emotional trauma, but you also have to you have to be able to fix the physical trauma that's associated with it. Years ago, there was a patient, she came in, and we're talking about 20, 25 years ago, and I didn't know then what I know today. And she had a lot of, she had a history of headaches that just never would resolve itself. And I did my normal thing, but I realized that this first vertebrae in the upper portion of the neck, the cervical vertebrae, was not able to be stabilized. So I knew a little bit about the emotional pathway. So I opened up that piece, and then I very lightly moved that first cervical vertebrae, and all of a sudden it was like a floodgate that opened up, and a tremendous amount of motion. And I remember her telling me, "I'm okay. You didn't hurt me. You didn't hurt me." And that's all it took to open up. But that memory of what had taken place, the blow she had taken to her head in a height of emotional rage, if you will, at that point, was no longer the thing that was hiding the physical, why she has the headache and so forth. So now we were able to resolve it very, very rapidly. But that happens in so many different things. A young child, perhaps, in an abusive family, whether it's a sibling or a parent or anybody else of that nature, and is getting smacked around at a very high emotional level, and whatever words come out and so forth, that buries itself. But you still have the physical trauma that's locked in years later, and it can be, pain somewhere in the body. It could even be as significant as a spinal curvature that shows up, a scoliosis pattern in a young person that there's no reason for it. There's no, we know that scoliotic patterns can pass through families, and it usually skips generations and so forth. That's just what the statistics show. But if you don't unlock the other piece, now you have a problem. How about when you go to the dentist and the dentist puts braces on your teeth and they move the teeth in a bad pattern, meaning they're not neutral. What is neutral when you move teeth? You have to get the temporomandibular joint to line up properly, because that's the pump handle of the skull. You have 22 bones that make up that noggin of yours called your skull. So if the dental bracing misaligns that temporomandibular joint, the hinge joint that you open and close your mouth with, then those other cranial plates, the 22 bones in their joint spaces, are going to be discoordinate. They're going to be locked. They're going to build up pressure because the spinal fluid can't move. And now we have headaches. And this could have happened from the time it was a small child. I have a patient that she had dental braces put on, and she ended up with a 27-degree spinal curvature. And there was, you could have an emotional platform. All of a sudden, there's feelings of self-worth and so forth that go along with those things. So we're tying in multiple pieces to this trauma. But the most important pieces I want you to think about is that when these things link together, often we put it aside. We begin to be forgetful because we don't want to remember. But we can do that in a lot of things. So over time, that memory pattern becomes very, very set aside, if you will, and we forget how to do things. We don't want to approach certain things. We have fear patterns that really make no sense whatsoever. And then we pass it through. But it's important that we understand that we're coming up to that part of the program where it's important that you understand. You can follow me within just the next couple of minutes. We're going to be on live stream. Just go to drtomroselle.com and hit the button, and I'll join you there as soon as we're done with the program. We're going to have fun doing this. This is going to be a major shift, but in a way to give you more and more and more data, more and more information that you can use and make a difference in your life. You're listening to Dr. Tom Roselle, and remember, I have your primary interest and concern. Why? Because I love you. Don't forget, join me in a second.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Brain Fog and Memory Loss on Wednesday, February 14th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.